So you can't see this, but hopefully you can hear it. Behind every Boise State Public Radio podcast is a team working hard to bring you stories that matter. So if you value podcasts like this one, please support them. Hit donate at boisestatepublicradio.org. Thanks.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Prior authorization. Those two words can cause fear in the hearts of patients and dread in the hearts of their doctors. That's when a doctor prescribes a medicine or a surgery or even a treatment, but they have to get approval from your insurance company before it can happen. It can be a lengthy, difficult process, heavy on the paperwork. And while you may have heard the words prior authorization once or twice, your doctor hears them all of the time as they struggle to get you the treatment you need. However, Dr. Patrice Burgess counsels doctors, especially young doctors, to rise to those challenges and to make a difference, not just in their patients' lives, but in the policies that they think need to be changed. And along with coaching young doctors, Dr. Burgess wears a lot of hats. She's a family medicine physician with St. Alphonsus Medical Group. She's also been medical director, chief medical officer, and the first female president of the Idaho Medical Association. And during the COVID-19 pandemic, she worked to bring Idaho hospitals into the incident command system and worked extra night shifts, saving lives. Oh, and one thing, don't tell her COVID is over. She says the virus is here to stay and says the vaccine is more important than ever. And the Ada County Medical Society recognized Dr. Burgess with their 2026 Physician of the Year Lifetime Achievement Award. And when the ACMS asked if we'd like to talk to her about her work, well, of course we said yes. We want to welcome Dr. Burgess to the program. Patrice, it's really nice to have you with us.
Thanks so much, Jim. It's great to be back with you.
So, Patrice, as I mentioned, you were a key physician leader during the COVID-19 pandemic. Can you take us back to the start of the pandemic? I mean, more than 6 years ago. Talk about bringing those hospitals together under an incident command system.
Yeah, well, I was just a part of that work. There were so many people that rose up to the occasion, and we were really just, figuring things out as we went, seeing the cooperation we had among our hospital systems here in Idaho and beyond. It was actually the shining light of the pandemic was how well everybody cooperated, and we had daily phone calls to find beds for patients, and really worked through a very difficult time together.
Can you talk to us about the strategy you took to protect vulnerable populations during COVID? I mean, particular the elderly and folks that were in nursing homes at the time as well.
Yeah, thank you. I was fortunate to be asked to chair the governor's COVID vaccine advisory task force, and we had a great group of people from all different organizations, representing their different constituents. And we had the tough decision of allocating vaccine. You may remember we were getting about 25,000 doses a week for a state at the time that had about a 1.6 million population. I think we've grown since then, but obviously just a drop in the bucket for what we needed. And so I'm proud of our group that we did prioritize, healthcare workers that were on the front lines, but also the elderly patients in the nursing home facilities. And I do think that made a difference and saved a lot of lives.
We've talked on our program about the lasting effects of COVID, but I'm curious from your standpoint, what should the average person know about the lasting effects, the lasting impacts of COVID on physicians, not just in our state, but really all across the country? And let me, say like healthcare workers in general, truly.
Yeah, I really appreciate that question, Jimmy. It's a real PTSD kind of situation, and I know there's a show that's become real popular, The Pit, that has a lot of flashbacks, and when I see those, it really does remind me of how difficult it was. I think there's no secret that we've lost a lot of healthcare workers that decided to tap out after that experience, and don't blame any of them. It was just really hard to see so much death. And we were in masks and PPE for a solid 2+ years, so we couldn't even see each other's smiles or, having encouraging words because we were overwhelmed with work, and we had very few visitors in the building. So it was a very somber time, and especially before we started seeing treatments that helped or the vaccine before it came out, we really had very little to do but just try to support people when they were having difficulty breathing and try to help people not spread the disease. So I think people forget, and people look back on it differently. Some people have some suspicion about some of the different treatments and issues that went on, but it was a really difficult time for healthcare workers, and I don't think we've completely pulled out of it. I've also heard that some people kind of don't hit the wall till a little bit later, so we're seeing some
Mm.
after effects still.
One thing that you have said is that doctors should turn policies that they may not like into a chance to make a difference. One being prior authorizations, which I mentioned in the intro. Why is that important to you about truly trying to make policy change?
Well, seeing patients day to day is a privilege and, my calling, and I love doing that. But I also don't want to ignore the problems that we and our patients face. And I think we read about burnout. I think that's where what leads to burnout is when you feel that you're just a victim of all these things that you can't do anything about. So being part of policymaking, being part of advocacy helps you feel like even if you're not successful right away, sometimes these things take years to fix. At least you're at the table trying to make a difference, trying to make things better. And that to me is an antidote to burnout, is joining together with other like-minded folks to try to improve the system.
You also do a lot of coaching of younger physicians who are new in their career as they're getting started in their practice. Talk to us about that and what it's like to help them, navigate this new career.
Working with medical students, residents, and young physicians is such a wonderful joy. It reminds you of the enthusiasm that you had when you first went into medicine and gives you that little extra pep. But also, I and all of us want to make sure that those folks don't get disillusioned, that they have just as good of a career, if not better, than the career that we had. So part of that is what I was saying earlier, is making sure that they know how to advocate, they know what their avenues are to get support, and that they don't feel that they're alone, and they don't feel like these issues are insurmountable.
If you're just joining us, we're talking with Dr. Patrice Burgess. She's a family medicine physician with St. Alphonsus Medical Group, and she was recently recognized by the Ada County Medical Society with their 2026 Physician of the Year Lifetime Achievement Award. So, my understanding is that when you were a family medicine resident here in Idaho, you were the only woman in your residency class. What has your experience been as a female physician over your career?
Yeah, we had back then we had one woman per year. It's a 3-year residency program, and you're correct. I was the only woman in my year, and things have just changed so dramatically. I think a lot of the medical schools and residency programs are 50% women or more. I would say it's had its ups and downs. There's times when I've been the only woman in a boardroom, and everybody else was referred to as doctor, and I was referred to by my first name. And you just kind of notice those types of things, or your idea may not be recognized, but one of the men in the room would say the same thing, and then that would be recognized. I think those days are
Mm.
past us, but I certainly experienced it intermittently over the years. But it's also probably opened some doors for me too that I'm very privileged and appreciative of. It's been a wonderful career, and now it is great also to see the diversity that we have in our profession that we didn't have when I first started.
Oh, is there advice that you give to new physicians? Because as rewarding of a calling this can be, I would also think that it can also lead to so many other issues, right? I mean, especially if you have like a once in a lifetime pandemic where you're seeing that PTSD, where you're seeing doctors overworked, right? And then you put all that paperwork on top of it. I mean, there's a lot that can be difficult even when this is a calling.
Yeah, medicine is a unique field or unique profession, in my opinion, where you can combine your love of science, your love of how things work, with your sense of service. And recognizing that, I think, is what really keeps all of us going. And it takes a certain type of person to put up with some of the things that you mentioned. But you always have to look at how many careers do you have where every single day you made a difference for someone. You might have a lot of frustrations that you can also refer to, but you go home every day and you think, there's at least one person, hopefully more than one, that you really made a difference for them, even if it was just answering their questions or just supporting them through a difficult time. And that's a real privilege, and that I think is what I counsel people to help keep them going.
You're also involved in national medical policy through your work with the American Medical Association. What is the AMA focused on right now? Like, which policies will the AMA be looking at in the near future?
Yeah, I'm very fortunate to have had a long career with the AMA and continue to work in leadership at the AMA and hope to continue that further. AMA does a lot of things that people don't always recognize, and I always encourage people to go to the website. It's ama-assn.org to see those things. Obviously, working on what you already said, prior authorization, and making sure that we reduce the administrative burdens of practice and reduce the barriers between the patient and the physician. So anytime there's legal or legislative action that interferes with the doctor-patient relationship, the AMA is there working to prevent that. We also look at overall trying to provide universal coverage to our population, and what are the different ways that we can go about that so that every American has some basic healthcare coverage. And that's complicated, as you know, lots of financial issues and
Hmm.
lots of barriers, but that is something that the AMA believes in as well. So it's about the doctor patient relationship, reducing administrative burden, and then helping make sure our patients are covered, and that we look at public health issues as well.
So, speaking of insurance issues, insurance coverage, I know that you've worked in the past on that, along with the fact that we have a lack of mental health professionals in the state of Idaho. How are we doing as a state when it comes to those two huge issues?
Yeah, we as a state struggle with doctors per capita, as you've probably heard. We tend to rank 49th or 50th in doctors per capita, and our entire state has been a mental health, a professional health profession shortage area. We continue to work hard on helping that. Probably the biggest need is our residency programs. I think you and I have a lot of familiarity with medical school and
Uh-huh.
residency issues. We actually do have enough medical school seats right now. We really need more residency programs for those students to then be able to finish their training. And we have good evidence that people that train in Idaho very have a high percentage of staying in Idaho. We do have now 2 psychiatry programs, and we've got a high retention rate. It just takes a while to train those folks. So we're doing the right things, but we do need to continue to expand those residency training programs to continue to feed that pipeline of doctors that will stay in practice in Idaho.
So before I let you go, as I mentioned in the very beginning, the Ada County Medical Society recognized you with their Physician of the Year Lifetime Achievement Award. I'm curious about what that feels like to be handed a Lifetime Achievement Award and what's next for you.
Well, it did make me think maybe they want me to retire, but no, it was very, very sweet, incredibly gratifying to hear from folks that they appreciated my work, especially during COVID. I'm not going to retire for a few more years, so it was just very gratifying, to like a pat on the back, to keep doing the work that I'm doing. As I mentioned, I'm still seeing patients, and then I also am continuing my work with the American Medical Association, and this just felt like a big hug to keep doing that work.
Well, we appreciate everything you do for the state of Idaho, and thank you for making time for us today. Really appreciated the conversation.
Always a pleasure, Gemma. Thank you.
We've been talking with Dr. Patrice Burgess. She is a family medicine physician with St. Alphonsus Medical Group, and she was recently recognized by the Ada County Medical Society with their 2026 Physician of the Year Lifetime Achievement Award. Thanks so much for listening to this episode of Idaho Matters. And for quick news of the day, start your mornings with our podcast. It's called The Connector, Idaho Daily News. And if you haven't yet, could I ask you to leave us a review wherever you listen? We read every single one, and we'd love to hear from you.
Each story you hear on Planet Money starts with a question. What happens if we refund tariffs? Why are groceries so expensive? At NPR, we stand for your right to be curious, because the forces shaping our world can be hard to see. Follow NPR's Planet Money wherever you get your podcasts and start seeing how the economy really works.